other item on our agenda, and then at the end of that is the quote, other, and then we're done for the day. This is Frank. He works with me, and you can introduce yourself, but he's here for the topic that was listed on here as the proposed diaper limit.
Yes, good afternoon.
Hi.
My name is Frank Hansel from DMA. I work very close to this with this lady next to me. Just wanted to inform you and get some feedback on the proposal from DMA to submit a budget reduction in the form of a policy limit. This will be pertaining to the pull-ups, diapers, briefs, and reduce the limit from 192 to 100. This will mirror what Virginia is already doing, and we hope to implement this June the 1st. So that's basically the notification. What I would like, if possible, if you can submit any comments, information, concerns to Kathy and her group. I'll stick around. Is this meeting almost over?
You're it, pal.
Okay. So I'll stick around to hear any comments or concerns.
$92 to $100 diapers.
Limits. That's going to be diapers
Cases.
per.
Cases?
No, diapers per month.
Diapers
Oh, per month.
Per month.
Oh, not the life people.
So you're saying six diapers per day, basically, is your upper limit on that?
Right.
For people who are incontinent?
Right. This is for.
So you can only get your pants changed 6 times a day?
Well, this would be, the DME policy is for kids 3 years and older, but you still would have the EPSDT federal program in place.
For children, but not adults or incontinent?
Correct.
They can only get their pants changed 6 times a day. That'd be okay with you? If you were incontinent, to get your pants changed only 6 times per day, I'm just asking.
Right.
Because I don't, I mean, that's 192 is your number, right?
Correct.
You're saying, no, you're saying 100 diapers. 100, wait a minute, it's not even that many. Oh, 192 was 6 a day, so now we're gonna say it's 3 times a day. 3 times a day you can get your pants changed if you're an incontinent adult. Wow.
And you
Wow.
have people who
Wow.
have medical issues like, irritable bowel syndrome, or maybe lactose intolerant. You know, some things that happen and then their stomach has issues.
Well, I pee way more than 3 times a day.
Yeah.
So what are you going to do,
3 times a day.
regulate their water intake and make them dehydrated? I mean, I don't even know how
So we
this
can pay the
could
hospital
even be
bill?
a proposal.
3 times a day.
It's inhumane. Or make them sit in
3
a
diaper
diaper.
changes a day.
Can you talk a little bit about why the decision to model it after Virginia, and maybe give us a little more on that too? And I'm not trying to get into these questions, I just want to know a little more about the context.
So, the state of Virginia went down to about 100 per month as of, I think it was about sometime last year. We have looked over the last couple of years at different ways in trying to see how we can what possibilities are there for cost savings with diapers. The state have attempted different attempts through an RFP, et cetera, et cetera. So this directive has been issued. So we're at the point now where you're the first stakeholder group that we're meeting with. So looking at some feedback, and the time to implement this is June the 1st. That's,
3 a day.
Is this just for innovation services?
no.
Medicaid
Any
benefits.
Medicaid, DMA, or
Correct.
So have you done a cost analysis? And maybe one of the things you might want to consider is a cost analysis for the skin breakdown when people are left in diapers, because that 3 diapers a day in 24 hours means that you're going to sit in a wet or poopy diaper for 8 hours at a time, plus or minus, because you don't have a sufficient supply of diapers to change the person. So how much do you think the medical costs will go up because of that, or urinary tract infections, or other issues medically? related to the fact that you're sitting in a stinky-ass diaper. I understand that's not your decision, Mr. Hunsel, but it's an absolutely asinine one.
Actually, I have a question. They have to have it based upon the number of diapers that have been dispensed in the past. What's the average number that people use on a daily basis now?
I think the question starts there.
Well,
Yeah.
I think, previously, up till 2009, we were not covering diapers through the.
No, but between then and now, there's been diapers sent out, and what's the average, just a mean number for use per day?
Most of the time, it's used up to about the limit, which would be 5
So
to 6 days.
192 would be a diaper change every 4 hours. But it really should be a diaper change every time you're soiled, for good health standards. So are we really after health, or are we after saving money? Because this is increasing poor health for people. It's not improving it. I thought the secretary was standing on a position of improving health.
I think it would be
That's
helpful.
not it.
So how were they paid for before 2000? It wasn't through DME.
I think there were some who were getting diapers through the waiver programs.
Right.
They were under
Cat C,
public
yeah.
health.
My son used to get diapers through a waiver program, and there were just boxes and boxes.
Yeah, there were no
So
limits.
I'm just trying to get an idea of when people had an option of having a new diaper every time they soiled theirs, what was that mean amount of diapers used per day?
It varied. As I indicated, before 2009, there were numbers up to 300, 200 a month, so it varied. And then when we implemented the diaper limit in 2000, I forgot the exact year. Clearly it was folks had to get used to the limits. There were concerns. There were complaints.
Get used to it. Get used to sitting in poop.
But there was
Get used
also
to sitting in pee.
an option
Get
of
used to it.
getting an additional, it's like a huge sanitary napkin that would maybe the sanitary napkin element that was put in the diaper could be removed and replaced. Do you know what I mean?
Liners.
There
I
was
think-
an
I think
option
it's-
with that for nighttime use, et cetera. Are you calculating those at all as
Doesn't pull it anyway.
Well, under DME,
in the numbers?
under DME, the liners are not covered. I know they're covered under the CAP-PA program. They're not covered under the waiver.
So if you
I think
wanted to save money by not having a whole diaper, wouldn't you save money by giving a bunch of these really thick liners so that if someone just urinated, then maybe the diaper itself would be sufficiently dry to where a liner could be switched in and out, and that would be cheaper, but at the same point in time, the person wouldn't be sitting in urine?
I think one of the things I'm going to suggest is that as the comments, because I know Cindy's really expressed pretty clear, is that I think that what you're looking for is more people supportive or not supportive of this
Oh, okay,
change.
excellent, well, that's easy.
Because I think that's start there. And then I think maybe the point, so I would start there. So I think that might be the question about consensus and then maybe what we would want to do is to get something back in writing to you if we were going to request feedback, to know how we would want that feedback.
Well, that's what he was saying at the beginning, is to email.
Right.
Yeah,
Right. So I think.
but I think the context was good. So, I mean, so you're doing this because Virginia did it last year?
No, I think we're doing this as an initiative to limit cost.
Okay.
Budget.
Just for curiosity's sake, what is the
This is where
annual
it
expenditure of
costs.
192 per
Really?
person per month?
It's about 28 million throughout Medicaid.
So will
That's a
you shift the
truck.
cost over to the ICF providers?
I'm sorry,
In North Carolina? 28 million.
through all the programs.
So should we contact the ICFMR providers and the adult homes and all those places you're going to get citations?
What I'm suggesting is that why don't you, I think we've gotten good feedback pretty quickly here. And that why don't you wait till we get a correspondence out to this group? Because somebody try to get in still, a correspondence into this group about how we would, what kind of feedback and how we'd like that feedback before we do anything else. How's that?
Do you want just to just email me, or
Why
do you
why
want
don't
something
we
specific?
why don't we get some format to go out first
Yeah.
before we do that, so we know how we want to get it back in. And, because I think once it goes out to this group, it'll get
Spread.
to a whole bunch of other people. So
Right.
Why don't we make sure we get you a feedback first?
Dave, could we also just get a little bit of a breakdown on diaper costs? Because, I know that for families, buying or getting diapers through DMA is more expensive for the whole process than it is out in the, kind of the public arena. So I'd really like to know what the cost to the state is broken down, if you will.
Broken down in terms of,
Well, you've given us an annual figure for the cost of diapers, and I realize that one of the benefits for families is to get diapers that fit young adults that are not readily available on the market. But I just really kind of like to have a little better sense of what that 28 by 8 breaks down. Maybe by diaper size or shape or what have you, but,
Is that
just,
bid? How does that go? How does that?
what do
all
you
come
pay,
together?
what do you pay per box cost or, sort of
That's where the
some
money
of that.
goes.
Something else too to think about as we go forward and get more information and really evaluate this is, from a health standpoint, if we think about how much people should be consuming liquid and food a day, what does that result in terms of average elimination, higher end, lower end, but to try to look at what the human needs in terms of eliminate, or what the human needs are in that, and what the impact would be. And I think that part of that research, I think, will be important too, in thinking not just about a number, particular number, but back to the person in this case, and what's healthy, and what would be begin to really show that it connects to the need, and what would be a reasonable potential number. I don't know that you're ever going to. For some folks, you may have many more diapers that are needed in a day. We know there's going to be folks on either end, but if again, it may be that a person might urinate 8 to 10 times a day, and have a bowel movement at least hopefully once a day, if not more. But so how does that translate then into the number of and what the need would be?
so you'd like to have some clinical indications of.
Well, I mean, if the intent is a cost savings measure, then you have to look at it's not just the incidental cost of that particular item, but again,
Was
the
the
holistic
increased cost
cost
going to be
of
somewhere else?
if there are infections or other health issues that arise because of that, then is this a savings or is it a cost? What's cheaper, the preventative or the curative?
Also, I think there's a psychological impact that I don't know if it can be quantified, the amount of misery someone's going to sustain having to be subjected to sitting in their waste.
Could you go to work?
I mean, I would find
Would your
that
job like
miserable
you to come
to
to
the
work?
point where it would create mental disturbance.
Social interaction.
And I don't really understand how there couldn't be a lawsuit that this is just unconscionable.
I think what would probably happen if we end up with too low an end, and I'll stop after this, is hopefully someone wouldn't, but the effort and the cost gets shifted off to someone else.
Right.
Most people are going to find a way to get a person in, hopefully. But then I think it goes back to Cindy, you mentioned, and others, is well, then where does that responsibility lie? And then how consistently will it be met? So I think it opens the door.
I'd just like to suggest that, again, that we've heard pretty clearly what people have said, and that it would make more sense for to have some sort of context that gets sent out in writing before we go any further to have that
And
conversation.
maybe do it
But
with
I
other
think-
states too.
I think her point's really good, that it's important to see how much they charge per diaper versus what you can buy in the open
On the
market.
yeah, that's a good point. Yeah.
Because it may be better to allocate a budget and let people buy diapers that maybe even fit them better and cheaper
Better
than
quality.
necessarily
Because-
just get
But you can't find them all.
the one that, the ones that come from the, whatever, through the mail are really poor fit and poor quality, and they might be very expensive because they're not produced in mass like maybe the Kirkland or Pamper variety or Depends are.
It's a great
So
point.
it may be cheaper and better on the open market.
So,
And
basically,
maybe consider a budget allocation, and there could be maybe a comparison of what that would translate to as X diapers if you were able to buy them yourself.
You could buy them at Walmart, you get really
Right.
good deals versus buying them at Carolina Home Medical, which is a
Right.
DME vendor.
Right.
It's three
So you
times
mi-
less.
You might end
at
up
Walmart.
getting, 9 diapers a day versus 3 for the same price. And also, it's important to, with our society these days, where people are encouraged to eat fresh fruit and fiber, you're gonna have more waste just. No, you would, than eating processed food or, right, if you eat healthier, you're gonna eliminate more.
Yeah.
I think you guys have made some great points, and I think one of the good things that you had is the first chance to have any comment about that, and I think it was really, because we were meeting, it was a chance to have an informal,
Sure.
just to get some feedback initially, and I
Frank
think,
said he'd stick around, so.
but I think before, but my suggestion is before you do anything, let us get something back out there to use as a format to respond.
Sure, absolutely. And some additional information, so we're not, so we have some.
Yeah, so just if you just hang on it, and we'll get something out that's more formal and gives you that background.
so can I just quickly summarize in terms of additional information that you would like to have? One of the things is some of the clinical indications, if this, we implement this limit. The other thing was the cost breakdown. How is this total budget for diapers broken down in the Medicaid program? Make sure they throw in the administrative overhead. Virginia, how is it in other states? So that's 3 takeaways. And then just to kind of, we have a fee schedule, and I'm sure you're aware of it, so that folks can, as long as it's a Medicaid provider, they can get their diapers from whoever. We don't have a sole source or are tied to one vendor.
But the DME vendors, all of the DME vendors have a significant price markup compared to what I could buy at Walmart.
So your recommendation is one recommendation I've heard, and actually it's not a bad recommendation on the waiver itself, is that you want the individual budgeting. Is there a way that you can actually just say, here's in that budget, you can include
Yes.
for that?
There's so
That's a
much.
great suggestion around waiver.
Yeah. And again, it may also drive the market so that there are.
So Frank will be here, I'll be tipping waitresses. So, are there any other innovations, business items that we haven't talked about?
I just want to say thank you for coming, and thanks for this opportunity for input. And I did just go make a call with a really large provider of adult diapers, and affirmation that this would be an unsatisfactory level and limitation on people, and we appreciate further study. And I do think that we could maybe provide some assistance on the cost direction, if you want to look at some other options, that just some input that we have from mass purchasers. I'll be happy to help with that if we can.
Thank you. And just for my education, can I have an overview of the
Oh, Deb didn't give you one?
no.
Well, why don't we tell you who we are? Well, actually, so the context of this group is we're going to do an amendment to our HCBS waiver. And this is a stakeholder group, parents, providers, LME, MCOs, some of the different professional organizations that for IDD folks. We're looking at doing exactly that. We're trying to come up with a more flexible waiver. So if you're stuck with under our waiver, it probably would be here's a dollar amount, So Dave? Okay, so maybe we'll go around past Dave and just introduce ourselves so you have an idea.
Hi Frank, I'm Carrie, I'm with the Autism Society of North Carolina.
And I'm Chris Egan. I'm with the North Carolina Council on Developmental Disabilities.
Bruce Olin, a parent.
I'm Bob Hedrick, I'm the director of the North Carolina Providers Council that represents very large and very small providers of people with all levels of intellectual and developmental disabilities and mental health needs.
I'm Cindy Ellers, I'm the Deputy Director of Clinical Operations at East Carolina Behavioral Health, and I'm also the parent of three waivers.
I'm Lynn Norton Ramirez, a parent / attorney / individual who likes to drink a lot of fluids.
I'm Melissa Barron, I'm with the North Carolina Association of Rehab Facilities, and I am also a caregiver of somebody on the waiver.
I'm Marlon Wells. I work with families who have children with special health care needs and also with disabilities, with the exceptional children's assistance.
I'm Beverly Moore, parent of Innovation.
I'm John Nash, with ARC North Carolina.
Rachel Moore,
Mine wins with DMH. Holly Riddle, policy advisor, DMH-SAS, similarly armed.
Renee Rader. You know Renee, you know Lisa, you know Nika. Okay.
And I'm Debbie Watson with Therapeutic Alternatives, but I did raise my hand. I want to just make one comment. I was the case manager for a number of years for the MCO and the ARC of North Carolina. And during the last decision in the changes in incontinence supplies a few years ago, when the quality was changed, all the families that I had were coming to me and saying they were using double the amount of their allotment because the quality had gone down. So how is that saving money on their person that they were caring for? That, they weren't going to let them sit there and sit and waste and lead to these other medical problems, which she has just addressed. So I think that is something to consider. Thank you for the opportunity.
And I'm Frida Quetch. I'm the Chief Operations Officer with Therapeutic Alternatives. We're a provider.
Rose Burnett with East Carolina Behavioral Health, MCO.
Paula Cox-Fishman, I'm guardian of my sister and also I'm a volunteer advocate, and I would like to say, dovetail with what you said. In addition to the cost of diapers, it would be interesting to get an administrative overhead breakdown of the diaper budget. Also, in addition to health considerations, I can tell you right now, I know individuals that if they need their diapers changed and they don't get changed, you have an explosive behavior problem on your hands. Thank you.
Okay, so for our next meeting, is there anything?
Yes, I have some other. Are we on the other section?
Yes, we're on others.
So on the other, so we had a couple of snow days, we had canceled, whatever things happened. We were on schedule to have certain deliverables at certain times. And I'm just kind of wondering where we are with that schedule, where we are with the schedule for the technical amendment, how that's all adjusted out.
So, you're right, we did get delayed. We are, and thank you, actually, I meant to say that at the beginning, and I got distracted because I couldn't figure out how to use that thing. We're gonna push back to April. We're gonna have to, obviously. I mean, we're here March 6th, and we have nothing for the technical amendment. I think that you want us just to get, so you want to just give an overview of the rest of the work group, like where the rest of your stuff is?
Okay, so
That would be help.
for the utilization management, utilization review, where we did the policy and everything, we're moving forward with all of that group. Should we just send out maybe something later? I can't think off the top of my head what our deliverables are coming up, but we're moving forward, and I think we can get you something. The service definitions, we're completing more of them coming down the line. Hopefully, within the next couple of weeks, we'll have residential supports, possibly crisis services, so we're moving in that direction as well. So we're maintaining our targets, I'd say.
But I've been waiting with bated breath for the whole creation of new residential group homes. And the kind of ass backwards way Cardinal has about not providing a letter to new providers until they've already invested and are ready to roll, and then say, we don't have any openings for new residential group facilities. I thought we had tabled that kind of whole discussion about, you know, the choice element and getting approved to create a residential group home, and I wondered when it was coming up.
Well, I think we're going to add that to one of our next agendas, all right, so we got it down. So we'll make sure that's either the next one or the one right after that, okay?
Okay, that's good.
All right.
So my other, I'm sorry.
Let's let Monica go real quick.
Well, on that, you're talking about public notices.
Yes, sir. For care coordination, we're, I guess, pretty much on target. Our next meeting on the 27th, we just want to present you all with the IDD care coordination training competencies list and have you review that and give us feedback. We'll also be bringing back the SIS policy for ISP planning. We never really got any, not really, we never got any written feedback, but I did remember and wrote down what Bob had said at our last meeting or a few meetings back about adding more information in about SQ verification and more information about how the SIS interviews